Elimination. Bowel and urinary elimination are essential bodily functions. Stool and urine production is a constant process that occurs within an individual unconsciously. The urinary tract removes waste and fluids from the body in the urine, regulates levels of electrolytes and production of red blood cells, and produces hormones for blood pressure to help keep the bones strong. The bladder is a hollow balloon-shaped muscle that stretches to accommodate up to 2 cups. During filling, the bladder muscles remain relaxed. Once the bladder has reached its capacity, the receptors inside the bladder send signals to the brain to inform the individual that the time has come to empty the reservoir. The amount of urine that is produced is determined by the functioning of the kidneys. Urine is extra fluid and waste that the body no longer needs or requires. Routine urine is light yellow in color. It is clear and does not have any cloudiness. The normal urine output is 30 milliliters per hour. The urine production, color, and odor are affected by the amount and the type of food and the liquid that is consumed, as well as any medications. Kidney function does decline with age. This will cause the loss of kidney tissue and nephrons, as well as any reductions in blood supply, leading to reduced amount of urine production. There will be a loss of tone of the bladder, which is a change that can lead to urinary leakage, incontinence, or retention. The digestive system, which is the liver, pancreas, gallbladder, mouth, esophagus, stomach, both small and large intestines, and the anus. Esophageal contractions decrease with age. The stomach elasticity will diminish, and there will be a decrease in peristalsis and muscle tone within the bowel. Urine is anticipated to be clear, light yellow in color, and odorless. Remember that the amount and the frequency of urine will depend on the fluids, the foods ingested, the activity level, and medications. Stool patterns will also vary. Healthy bowel elimination will result in a soft, formed stool that is easy for the individual to pass without straining. Urinary incontinence is the inability to control urination. This can cause involuntary urination. Often this problem will affect retention and releasing of urine. There are many types of urinary incontinence. One is stress incontinence. If an individual coughs, sneezes, laughs, or has any specific physical activity, this can increase pressure on the bladder and allow some urine to escape. Urge incontinence is when an individual has a strong need or an urge to urinate. Leaking can occur for the individual before they reach the toilet. Reflux incontinence is urine leakage that is caused by nerve damage. Overflow incontinence is an incomplete emptying that causes the bladder to overfill, and this leads to urine leakage. Functional incontinence is a physical inability to reach the toilet in a timely manner. Could be due to the individual being in a wheelchair, having arthritis of the hands. There are many various reasons. Nocturnal enuresis. This is common in children. This in an adult can occur with too much alcohol, drinking caffeine at night, or various medications. Urinary retention. Here the bladder does not empty completely with urination. Various health problems like enlargement of the prostate, cystocele, these all can prevent the evacuation of urine and cause a difficulty with urinating, cause pain, cause abdominal distension, urinary frequency, urinary hesitancy, and a weak or slow urine stream. On the bowel side, constipation can often be due to infrequent bowel movements. Here the stools may be hard, lumpy, and difficult to pass. Various interventions may include a high fiber diet, drinking fluids, especially water, exercising, bowel training, or various medications to soften stools. Diarrhea. This is frequent loose and watery stools throughout a various time period. It may be acute that lasts 1 to 2 days, or it can be persistent that lasts longer than 2 weeks but less than 4 weeks. Or this may be chronic. So chronic constipation lasts longer than 4 weeks. The interventions that may be used would be removing any irritating factors that may cause the diarrhea and rehydrating the patient. Bowel incontinence. This is also known as fecal incontinence or accidental bowel leakage. This is variously common in adults that are older than 65, individuals that may be hospitalized, or individuals in a nursing home. In children, bowel incontinence is also known as encopresis. Medications can affect urine production as well as stool production. For urine production, these medications would be diuretics because they rid the body of excess fluid and salt. They can assist to reducing blood pressure, treat various heart conditions as well as edema. There are 3 categories of diuretics: thiazide diuretics, loop diuretics, and potassium-sparing diuretics. For stool production, the various medications that may affect it are antibiotics and magnesium-containing antacids, because these will increase the gastric motility and cause edema. With the patient that loses an excess of fluids, this can lead to a negative fluid imbalance. This can be associated with excessive vomiting, diarrhea, sweating, urinating, or not enough fluid intake. Urinary tract infections. These are bladder infections routinely caused by bacteria that enters into the bladder. It is more common in females, and if it is left untreated, may result in pyelonephritis. Kidney stones are also known as renal calculi, nephrolithiasis, or urolithiasis. Kidney stones are hard formations of minerals that vary in size, shape, and severity. If a patient is experiencing kidney failure, that means that they have a loss of 15% of the expected kidney function that will permit the substances to accumulate. Kidney failure can cause reduced production of urine, joint pain, an increase in blood pressure, heart disease, anemia, or itching. A prostate enlargement is a various condition that affects males as they age. Benign prostatic hypertrophy, or BPH, is a non-cancerous mass that causes constriction and will increase urine retention in males. Diverticulitis can also cause various elimination pattern changes. These are small sacs or pouches that form on the bowel. They increase the risk for diverticulitis, which is a common condition, and the risk does increase with age. Irritable bowel syndrome, oftentimes the patient will have abdominal pain, changes to bowel elimination that may include diarrhea, constipation, or both. Ulcerative colitis is considered chronic, routinely causes inflammation and ulcerations of the large intestine or the colon. Routinely, the onset is gradual and the condition will worsen with time. Crohn's disease is a chronic disease. This causes inflammation in the gastrointestinal tract or the small intestine. A urinary diversion is made when the expected flow of urine is interrupted. These can be temporary or permanent depending on the damage to the urinary tract from injury, could be a birth defect, a tumor, or bladder malfunctioning. Urinary catheterization, this allows the urine to drain. It's a flexible tube that is placed into the bladder through the urethra or an opening in the lower abdomen. A ureteral stent allows urine to pass from the kidney to the bladder when a ureter is blocked, maybe a stone or a tumor. A urostomy or an ileoconduit, this is a surgically created diversion that uses a piece of small intestine. A nephrostomy drains urine directly from the kidney into an external pouch. It is routinely, the opening is on the back where the kidney lies. A continent urinary diversion is also known as a neobladder or a continent cutaneous reservoir. Either of these can be made to assist the patient to allow their urine tract to function appropriately. A cystostomy is a catheter that is inserted to the bladder, and there is an attached drainage bag on the outside of the abdomen. For a bowel diversion, these are required when part or all of the intestinal tract does not function appropriately. Surgery is performed to create either a temporary or a permanent diversion for the fecal matter. An ileostomy can either be temporary or permanent, and it uses the terminal end of the small intestine or the ileum. If it's a permanent ileostomy, the entire colon, including the rectum and the anus, are removed or bypassed. A colostomy is a diversion where part of the colon is used to form a stoma through the abdominal wall. This allows for the removal and passage of body waste. If it is sometimes maybe temporary, if the person has had bowel surgery and the bowel may need to heal and rest, or these can also be permanent. A J pouch is an internal pouch that is formed with the ileum. There is an internal reservoir that connects to the anus after the removal of the rectum and the colon. A cock pouch uses the ileum to form an internal pouch with a valve. The intestinal contents do not escape the ileostomy. These need to be removed. Various tests are done to check function. A urinalysis evaluates for bladder infections or urinary tract infections, kidney infections, kidney disease, or diabetes. A urinalysis test includes visual exam, a dipstick test, and a microscopic exam of the contents. A urine culture evaluates the urine for the presence of bacteria or yeast. A 24-hour urine collection. The urine is collected over a 24-hour period in a special container and that needs to be refrigerated. A fecal occult blood test. This checks the stool for the presence of any hidden or occult blood. A stool culture is used to find organisms that may cause severe or persistent diarrhea. There are various nursing interventions that are done to assist the patient with evacuation of either the bladder or the bowel. A catheterization can be a straight catheter, an indwelling catheter into the bladder, can be a condom catheter or an external female catheter. Medications for the bladder system are antidiuretics to help control fluid balance by decreasing urine production. An enema is an installation of a liquid solution through the anus to help relieve either constipation or to cleanse the bowel before a procedure. Medications that may be provided for the bowel are laxatives and stool softeners. These both work slowly and are intended for a less severe form of constipation. A rectal tube is a device that is placed into the rectum to prevent incontinent individuals from soiling themselves. Bowel training, this will assist the individual in gaining control of their bowel movements and provide a more set schedule. A nasogastric decompression, these are flexible tubes inserted into or in through a nostril and advanced to the stomach. This allows the removal of stomach contents and can decompress the stomach.